Well, the CDC is considering some new looser guidelines that would make it easier for some people to go back to work. According to the Associated Press, these new rules would affect people who are asymptomatic but have been exposed to someone with the coronavirus. Those people would be allowed to go back to work if they test their temperature twice a day and wear a face mask. That announcement could come as soon as today. Joining me now for a little bit of medical insight, Dr. Alexander Garza. Dr. Garza is the Chief Medical Officer of the SSM Health and head of the St. Louis Metropolitan Pandemic Task Force. He helped develop the nation's response to the H1N1 virus in 2009 when he was the Chief Medical Officer in the United States Department of Homeland Security. So, Dr. Garza, this would essentially, I guess, be a virus passport, if you will. But here's my... if the CDC is comfortable saying this now, do we know for sure how long we have these immunities, or how long, whether someone who is asymptomatic now, maybe in 6 months, doesn't? I mean, isn't there a lot we don't know before talking about guidelines like this?
Yeah, Chuck, there is a lot we don't know. So I think it's important to say whether it's an immunity passport, which this isn't. This is merely giving people the ability to go back to work 14 days after they've been exposed to somebody with the virus, which is what we do in the healthcare field. But you know, you have to understand those are extremely essential workers, and so the other difference is healthcare workers, they understand, you know, the risks that they could be potentially exposing people, and we have our processes on how we check temperatures and make sure our healthcare workers are not infected, or at least not symptomatic. It's a little, I think, premature right now to be talking about things like this, and the reason why I say that is you're seeing the height of the surge in New York City. The surge is going to be coming to places like St. Louis in about 2 to 3 weeks. And so we're doing everything we can to prevent spread. And this would sort of go against that notion of the social distancing and all of the other things that we know are effective in preventing spread.
Now you're getting at something that I think is going to be the most difficult in reopening, which is what may be ready for New York may not be ready for St. Louis, may not be ready for Chicago, because everybody's peak is at a different time. Should the CDC not be issuing guidelines when clearly we're still under a wave scenario when it comes to managing this?
Well, I think the other piece of information that we need to know is what are they considering essential workers as well. And so if it's a very well-defined population that we can, you know, keep eyes on, make sure they're doing temperature checks, all of those other things, then it may be manageable. But remember, about 30% of people walking around with coronavirus infections show no symptoms at all. They have no fevers, they have no cough. None of that, and so it's really hard to predict who is actually infected and who isn't. And so you have to consider all of those different things when you're starting to make these sorts of policy decisions. And I'll just add one other thing, Chuck, and that is, and you brought up a good point about when do we start relaxing some of that social distancing. And we don't know that until after we've seen some of those peaks start to come down. There's a long history of people relaxing social distancing rules only to see a second wave come along, and we don't want those things to happen.
I guess my ultimate out question to you, though, is this, which is how can we make any of these decisions without a broad ability to test people, whether they're asymptomatic or not? I mean, we've yet to test 1% of our population. I just feel as if we're wasting our time. We're running in place here until we can do that, right?
Right. No, you're right. We're sort of, it's difficult to do what you're suggesting, which is that epidemiological surveillance in the middle of a pandemic. We don't have enough supplies to do really broad-based testing like they've done in South Korea and other places. And so essentially we're not doing a good job of surveillance by using testing, and so maybe we should resort to some other methods such as syndromic surveillance, which is looking for symptoms instead of actual testing. Right. There's some other testing that's going to be coming online probably within the next month, which is serology testing, which is looking for antibodies. And what might be a viable strategy is to forego this testing right now, look for symptoms, and then when serology testing comes online, look for people that have already been exposed and are cured, and that might be a much better strategy.
Dr. Alexander Garza, who is in St. Louis, I believe, on that pandemic council there. Thank you for coming on and sharing your expertise.
Anytime.
I appreciate that. Up next, an Inside